Everybody for being here today. Today is a good day, an important day for Team Kentucky and the future of this Commonwealth. I ran to be your governor based on my belief that Kentuckians would embrace a compassionate but clear-eyed agenda and policies that improve everyone's lives, where every Kentuckian counts. Policies that would help us build a brighter, better Kentucky. Healthcare isn't an issue. It is a value and a basic human right. So even before our Commonwealth was hit by the ongoing global crisis, long before it became clear that the fight against COVID-19 would be the defining battle of our generation, delivering quality health care for all Kentuckians was the top-line goal of my administration. Today, Team Kentucky takes a giant leap forward on this promise. Today, we are relaunching Connect as an updated portal connecting Kentuckians with healthcare options. It will connect those in need with community-based resources, including food assistance, child care needs, job training, recovery, foster care, and so much more. This is a newer, better, more comprehensive Connect. In its original form, launched by a different Governor Beshear, Connect was a nationally lauded state-run healthcare insurance exchange. When the state launched Connect and expanded Medicaid, it provided healthcare for the first time to almost 400,000 of our fellow Kentuckians. After that expansion, Kentuckians could go see a doctor without fear of bankruptcy. They could get regular checkups to make them healthier. We saw people start to come into the system to not just show up at the ER, and we saw the beginnings of real change in our people getting healthier. We have seen how critical that expansion is and how critical healthcare truly is. Medicaid has helped so many Kentuckians get the critical care they need during this health pandemic. It has been the difference between life and death. When we look at statistics across the country on COVID, they should look very different. When you look at where Kentucky ranks in heart, lung, and kidney disease, our outcome should be much worse than it is. Now, losing 1,200 Kentuckians is something that I will never be able to accept. But we know that the launch of Connect and the expansion of healthcare is the reason that we haven't lost so many more. Healthcare isn't just a basic human right, it's the reason a lot of people are still alive right now. And while we have made so much progress, we still have so much work to do, particularly in a state where we have some of the worst healthcare outcomes in the country. Kentucky is in the top 10 in lung cancer, diabetes, and heart disease. The new Connect is going to help change that. Connect is an expanded, one-stop, mobile-friendly portal to connect Kentuckians with all the healthcare resources they need, right there on your phone or maybe on your computer. In addition to health insurance, the portal does so much more. It's going to help Kentuckians determine eligibility and guide enrollment in a variety of other programs. But these are all programs that are made to improve our lives, to look out after Kentuckians. Think about somebody struggling. We see it right now in the middle of COVID. They need to make sure they have coverage in health care. They may need food assistance. They may need connections to other support services during a difficult time. Going to one place and determining everything that you qualify for is going to help us as a state government provide for more of those needs for our people, especially in this time of crisis. Among these other services, Medicaid, the Kentucky Children's Health Insurance Program, where we need to sign up every single Kentucky child for K-CHIP or some other form of coverage. The Kentucky Integrated Health Insurance Premium Payment Program and other qualified plans through the Kentucky Health Benefit Exchange. But Connect will also help qualified families get SNAP food assistance benefits they need and deserve, along with other family and child care assistance programs. Our children, they are our most precious responsibility, and we have a duty to protect and to provide for them, and Connect is going to help us do that. Connect also has targeted resources for job training, veterans with disabilities, elder care, substance abuse recovery, among so many other connected topics. It's a place to go to if you just need a little help. Our veterans and their families have sacrificed so much, and now they're going to have more resources, again, just at the click of a button. Those overcoming addiction, those seeking employment or needing senior care, we have thought of you, and we are providing information to help you. And while our full return to a state-run insurance exchange won't happen for another year, the time for the new Connect portal is right now. And let me just say, we know when we return to that state-run exchange, we're going to save about $15 million a year, and we're going to make sure that we use that to keep premiums down and for other programs that get us healthier. All this couldn't come at a more crucial time. From the start of my administration, I pledged to protect health care as that basic human right. And one of my very first acts in my first week as governor was to overturn that Medicaid waiver, to withdraw it, that would have kicked 100,000 people off their health care coverage. Think about an extra 100,000 people that wouldn't have had coverage during COVID. My administration is still also involved in litigation to protect the Affordable Care Act. It's in front of the U.S. Supreme Court, and we must win this case. To me, it's not about red states or blue states. It's about the Americans that live in all those states. And where we have 1.8 million Kentuckians and countless Americans that have pre-existing conditions that wouldn't have their coverage guaranteed and could get kicked off of their plans. Think about Kentuckians with conditions like asthma. I'm one of them. Diabetes, cancer, even pregnancy could be considered a pre-existing condition where you could lose your coverage. You know, I started that lawsuit as Attorney General. I'm continuing it as governor because it is the right thing to do. Sure, we need to improve the Affordable Care Act, but getting rid of its protections would be disastrous for our people. As your governor, you should expect even more where that came from moving forward. The health and the education of our people, those are the keys to unlocking the potential of what this Commonwealth can be. Connect, it's not for me, it's not for my dad, it's for the people of Kentucky. It puts the power in their hands. The portal provides the platform Kentuckians need to take action, so I'd ask people, go to that portal now, connect.ky.gov. Spend a little time. It's been thoughtfully designed to help educate Kentuckians about options and to guide them through making the right decision in an enrollment process. The portal is critical right now because, like nothing before in any of our lifetimes, the coronavirus has laid bare what happens when people don't have health care coverage. It has reminded us how much we rely on heroic doctors, nurses, and other frontline caregivers and staffers, all manning our hospitals, our nursing homes, and our long-term facilities. Those caring for the most vulnerable amongst us, often while putting their own health at risk, represent the best of Team Kentucky. I can't help but think of Dr. Shadowin, who we lost in Bowling Green, an amazing doctor whose last plea to the public in an interview was put on your mask. She inspires us. All of her colleagues inspire us. And I am deeply and will be eternally grateful for their courage and their sacrifice, sometime with their lives, during this pandemic. This deadly crisis has exposed structural weaknesses in our healthcare capabilities and our supply chain systems. Worse, it has cast a spotlight on health disparities that we should have ended long ago, disparities created through generations of racial discrimination. I cannot know this pain. Even opening my mind and heart to the lived experiences of others, I know the best I can do is to listen and to try to hear at true pain and frustration created by hundreds of years of slavery, segregation, Jim Crow racial violence, and systematic racism. But I've promised to do what I can to build a better Kentucky, one without racism and oppression and violence. Black and African American Kentuckians are dying at twice the rate they make up of the population due to COVID. It is unacceptable. This week, we will be providing an update on our work to address that very disparity. And here's a quick preview. It's good news. We also face an ongoing opioid crisis that didn't disappear when COVID sprang up, and it's killing far too many Kentuckians, stretching our healthcare capacities and devastating our workforce. Worse, it's tearing apart families. The seriousness of all these issues is highlighted by the current pandemic. This crisis calls on us to not just act with care, but with speed and determination. It requires us to address the immediate needs of the moment while keeping an eye on the better Commonwealth that Brittany and I dream about for our kids, but that we have a responsibility to help create for everybody else's kids. The new Connect portal will aid these efforts. It'll foster a healthier populace and a stronger workforce. It'll encourage equity and fairness in our outcomes. Most of all, Connect puts the power in your hands so you can take control of your health care. My administration will be actively working in our communities and with our community partners to make sure every single Kentuckian who needs these services gets them. Now is the time that we push to make sure that every Kentuckian is enrolled for some form of health care coverage. And during this pandemic, there have been many, many dark days. One of them was yesterday when we announced that we had shattered our largest ever weekly total of COVID cases by over 1,000 more cases that week. But while we have had dark days, today is a bright spot for the Commonwealth. Let's continue to come together to create these bright spots and to truly make this Commonwealth what its potential tells us it can be. Right now, we're taking a step forward to build that better Commonwealth, fulfilling a mission where Kentuckians have good paying jobs, access to affordable health care, where education comes first and everyone can change the trajectory not just of their lives, but of the generations to come, where retirements are healthy, and where we treat people the way that we want to be treated, with dignity and respect. We are in a difficult time, but times like this create the potential for a brighter future, one where we can be more than maybe we thought was possible in a short period of time as we come out of this pandemic. The way we have come together to battle COVID, and we're going to have to continue, gives us so many chances moving into the future to better the lives for every single Kentuckian, because every one of you counts. We now like to introduce our Lieutenant Governor, a great partner in governing this Commonwealth, Jacqueline Coleman.
Thank you, Governor, and thank you, First Lady. I'm very proud to be here, and that covers all of the hats that I wear, whether it's Lieutenant Governor, Secretary of Education, a mother, or the hat I've worn the longest, a rural Kentuckian. We know that this is a huge step in building a better Kentucky for every Kentuckian across the Commonwealth. In this better Kentucky that Governor Beshear has spoken about, all of us deserve access to quality health care and to nutritious foods. Our administration is committed to expanding access to these and other basic human needs. When I was a teacher in the classroom, it was obvious when my kids did not have access to those basic needs that so many of us take for granted. Things like health coverage, pharmacy benefits, and quality food. As an educator, I can tell you how important the information on Connect is to our teachers, our school administrators, our parents, guardians, and of course, to our students. Access to good medical care, nutrition, and other benefits positively affects our kids' physical health, their mental health, learning, and social development. But we also know that lack of these impedes the development and learning capabilities of our most vulnerable Kentuckians. We know that barriers in these areas only increase the educational divide that we see in so many poor communities, both urban and rural. Often these services that can help Kentuckians push through these barriers, but they are not taking advantage of them because they simply do not know that those services exist. Connect is poised to dramatically increase public awareness of the assistance available for critical services like healthcare coverage, food assistance, subsidized childcare, and many other benefits. A good example of the awareness that Connect will bring is that thousands of children currently qualify for $0 health coverage, yet they are not enrolled in the Kentucky Children's Health Insurance Program, or KCHIP as we like to call it. Also, no-cost meals are available for children who qualify. Whether they're in a physical classroom right now or whether they're learning at home, they don't have to do that on an empty stomach. Connect will help get the word out about these programs. The resources area of the portal connects Kentuckians with information about job training, foster care, and assistance for veterans, people with disabilities, and the homeless. A healthier Kentucky is a better Kentucky because it leads to stronger families, higher educational attainment, a robust economy, and a better quality of life for everyone. A better Kentucky is what we all deserve. Connect is administered by the Cabinet for Health and Family Services, so I am happy to introduce their Cabinet Secretary and a great partner in the Bashir Coleman administration, Secretary Eric Friedlander.
So today is a good day. I am Eric Friedlander, Secretary of the Health and Family Services Cabinet. The Cabinet's a big cabinet. We have Medicaid, we have the Department for Community-Based Services, we have behavioral health, aging and independent living, income support. I could go on. We have a lot of programs. And because we have a lot of programs, it's sometimes difficult to figure out how to access these programs at the Cabinet. We've had different things called Benefine and some of the resource engines under different names. And what we've learned through COVID is the best thing we can do is to bring people together under one umbrella, is to bring people together, period. And that's what we're trying to do today. So, this program will bring together a lot of different systems that we administer in the Cabinet. This is in keeping absolutely with making sure that we have a healthy Kentucky, that all Kentuckians deserve health care. We also happen to believe that all Kentuckians deserve not to go hungry and to have food when they need it. And there is no better time that illustrates all of this than during a pandemic. We also want to say how much and how important it's been to work with our local partners, and you'll see that when we get to the resources page. So what we've done is we've retooled and we're relaunching Connect. We want to make it simple. We want to make it accessible. Our programs are often complex, and getting to them, getting through them sometimes can take a while. So this is mobile enabled. It is intuitive, and we hope it will be simple for folks to be able to come to one place and get services and find services. So we have a lot of people to thank. We had technology experts that helped us kind of navigate all of the various IT pieces that are always so difficult. Assisters who helped us test this and make sure that it made sense in the field, as well as then some of the community partners that we have here today. Kentucky United Way, Kevin Middleton, thank you, and thank you for your partnership. I'm going to go into that a little more as we go on. The Kentucky Primary Care Association, Carol Atkins is with us. The Kentucky Mental Health Coalition, Sheila Schuster, thank you for your tremendous partnership with us. Kentucky Voices for Health, Emily Beauregard, thank you. As well as David Allgood with the Centers for Accessible Living. I really appreciate you being here, David. Thank you. And we have a couple of commissioners. We have Commissioner Lee from Medicaid. We have Commissioner Marta Miranda Straub from Department for Community-Based Services, and a couple of other folks from the cabinet who are here because this is really a great day. So Connect is the gateway to 3 different types of resources. First, you heard the governor talk about health care coverage. So this is the way that you can get into Medicaid, apply for the presumptive eligibility that we've been talking about, K-CHIP, because children do better when they have health care coverage and receive health care. There's no question about that. And it also gets you to what is now the exchange on the federal-based state exchange based on the federal hub. That's where we are today. Next year, we hope to bring back the state-based exchange, and this will be your way to connect through that too. Second, there is the benefits hub. And this is something, again, we talked about a little bit of a change on the healthcare side that will come up in the next year. There'll be some changes here too, but right now it's your gateway into SNAP to get those benefits, to get KTAP, which is Emergency Financial Assistance, and CCAP, and we've talked a lot about the importance of childcare and how important that is for people to be able to go back to work. This is the way to access those programs. We hope in the next year to bring more programs on with the cabinet. WIC is one in particular. So as we work through these programs, we will try to bring them into this portal so that you can have one access to the services at the cabinet. Third is the resource engine. I'm really excited about this one. This, as I said, United Way of Kentucky has been a tremendous partner. Kevin, again, thank you. We have been talking about expanding 211 to all 120 counties, I think, for 10 years. This is an opportunity that we are using to make that expansion. Within the next few months, we will have coverage of all 120 counties of 211. This is a great partnership. This is where you can go to find local resources all across the Commonwealth, no matter where you are in the Commonwealth. As this rolls out today, the central region and northern regions of the Bluegrass have the 211 coverage that will be loaded into the resource engine. We will add more. Southern Bluegrass, Louisville will be added to this so that within the next, again, few months, we hope to have all 120 counties covered so that you will be able to find your local resources, those folks locally in your community that will make a difference in your life if you need that assistance. Because I want to say, if there's one thing we've learned through this whole COVID experience, is that whatever happens to one of us in our community happens to us all. And when we are living to our better natures, we are here to support each other, and this is a way that we can do that. So I'm very excited for this day. I like the Connect label. Those of you who remember the Benefind rollout know that that wasn't as good. So again, this is marketing this in a different way, and marketing this in a way that we believe is going to be successful, that we're going to be able to build upon and make a difference. Now, some of these changes were started in the previous administration. Some of these changes around the self-service portal, some of these changes around the resources, we are building on success, and we plan to build on success, and we want to continue to be successful. Next up is Deputy Secretary of the Cabinet for Health and Family Services, Carrie Banahan. Carrie has over 30 years of experience in state government and in the Cabinet for Health and Family Services, just like I do. And she's back for the same reason I am. She's back because she wants to make a difference in the lives of Kentuckians. She's back because she knows the programs at the Cabinet for Health and Family Services can make us a better Kentucky. So, Carrie, thank you for joining me back again, and I welcome you up here to the podium.
Thank you, Secretary Friedlander. I'm very excited today about the expansion of Connect. So, do we have the Connect? Okay. So, the heart of Connect is the web portal. We want people to get in line and not online to apply for benefits. The website has been redesigned and has a new look and feel for increased access and will be easier to use. The website is mobile friendly. You can use a smartphone or tablet to apply for benefits. With the new website, you'll be able to apply for health care coverage, SNAP, or child care benefits, access help tools, track progress of an application, and view next steps, snap photos of documents, and upload them to your application with a smartphone or tablet, and see other programs for which you may be eligible for by using our pre-screening tool. And you can also find the closest Department for Community-Based Services office in your county. So this is the Connect landing page, and it was designed to synergize with the original Connect application and its brand recognition. It provides a platform. Can we scroll down a little? The next is, so this is the bottom of the landing page. It provides for a platform for Connect benefits, Connect resources, and Connect health coverage. Next slide. If you click on the Connect benefits screen, you'll actually land on our Connect benefits landing page where you can use the pre-screening tool in the purple, or you can apply for benefits or find out about other programs that are available. Next slide. The relaunch of Connect means reconnecting with a well-received, unforgettable brand. Kentuckians will be familiar with the distinctive look. It features Kentuckians from all walks of life. The advertising campaign will begin on August 12th, and it will reach all 120 counties. Let's show the TV commercial.
It's a new day in Kentucky, again. Because the name that came to mean better health for families all across the Commonwealth is back, and it's even better than you remember. That's right, Connect has returned to bring quality, affordable health coverage to families and individuals all across the state. But now there's even more to Connect. Our new and improved website is designed to be your one-stop shop for a whole range of benefits and resources, all designed to keep your family safe, healthy, and happy. We know times are challenging right now, and a lot of people need help who never thought they would. And that's exactly why Connect is back, to help ensure better health and a better quality of life for every Kentuckian. Because we're all in this together. So visit us online to get the help you need. Thanks to Connect, things are looking up. Connect, together for a better Kentucky.
Thank you. Don't you all love the balloons? I love the balloons. We resurrected them, I think, from our first campaign. All right, so we have some additional slides here. You might see some of these on billboards or on social media. These are some additional advertisements. I love the Connect is back, and we brought back up. Next slide. And it's time to reconnect. Connect together for a better Kentucky. All right, so thank you. So, Governor, we're ready for some questions.
All right. I think on questions we'll do this old school for whoever has them, and then we'll go back this afternoon to the way we do things at 4. So. So the question is what is this versus what we're launching next year, and does this replace Benefine? That answer is yes on the Benefine. What we're launching next year is a state-based health insurance exchange, pulling it back from the federal. But Connect was more than just that exchange piece, and this is going to set up one location where right now you can get on what we call the federal exchange, though we have a state version of it. But you can also get assistance for so many other things. And I think it's taking some of the best parts of Benefind and improving upon them. It's definitely not what Connect was when it was first launched, and it's more than what Benefind was as well. I think that this is just the next step in getting people an easy tool to get health care, to get food assistance, and so many other things. Substance abuse disorder assistance. Connect is kind of the way that we're going to wrap our arms around Kentuckians and let them know that we're here to help.
Massive undertaking to get all this IT stuff to put this in order, but you have this ready to roll out. How come we can't do the same thing with unemployment?
The question is, with what we're rolling out here and how efficient it is, I'd also like to point out that Pandemic Medicaid has worked incredibly well during this, pandemic EBT, food assistance, and others. We have had challenges with unemployment. And the challenge is that Benefind, as it was left to us, had issues, but was certainly in a better place than especially the IT infrastructure in unemployment. That we had a healthy cabinet that had the resources to go about putting this together. And the other thing is, when they approached me on this, I always wanted to make sure we got back to a state-based exchange. I wanted to make sure that we were providing better help for people. I never imagined that it would be called Connect again. But they showed me the brand awareness that's out there, that people already connect to Connect, and what it's for, and how that had persisted over the 4.5 years when we no longer had Connect. So we're excited about this. The question's on open enrollment. I want to make sure we get it fully right. So, Ms. Banhan? Right. Oh, right. Come on up.
So from the health coverage balloon on the landing page, individuals will be able to click on Kentucky Health Benefit Exchange offering qualified health plans. That takes you to the Kentucky Health Benefit Exchange page, and there's a tile there where you can access the federal exchange and apply for qualified health plans. I'm not used to this. You all are professionals here.
Yes. When we think about what Connect is today, it is an exciting improvement on a foundation that was laid by the last two governors and in different ways. But the future, I think, is even brighter with the structure that we set up. As we have the new MCO contracts, once they go into effect, we've got a lot of opportunities with them and with a state-run exchange starting next year to also create a transition for people to go from Medicaid or expanded Medicaid into work, but to be able to stay with the same provider, see the same doctors. It's a real opportunity to streamline what it can be a really complicated healthcare system and not create or address disincentives sometimes for taking that next step. Yes, ma'am.
Two questions. The first one is, I've been seeing this commercial, and it seems like it's geared towards minorities about getting health coverage. I was wondering, how does that relate to this? My second question is, if Judge Amy Coney Barrett is appointed to the Supreme Court, do you have any concern about the Affordable Care Act being dismantled?
Two questions. The first one is about our program to address disparities, racial disparities in healthcare coverage. That is an active program that we are running right now. We're going to have a report on it later this week. It has already exceeded expectations, but it's based on the value that everybody should have health care coverage. It's a basic human right. And what we see in a time of COVID is primarily our Black and African American Kentuckians have been deprived of equity when it comes to that basic human right of health care. And we are trying during COVID, especially when we see the disparity in deaths, to address it as quickly as we can. It will work together in the way that you can sign up here, but we are separately running that, you could call it a campaign, that effort to sign people up, and it's been ongoing. Thus far, it's been really successful. We're looking forward to an update later this week. Second question is, if the new nominee becomes a Supreme Court justice, do I worry about the Affordable Care Act being overturned? Overturning the Affordable Care Act would be devastating to the people of America. You think about everybody out there with pre-existing conditions. It would allow people to be kicked off their current coverage simply for having a pre-existing condition. And we all have a pre-existing condition. We just don't know it yet with some of us. It would allow discrimination against women and seniors again, which the Affordable Care Act banned. It would reopen that donut hole for seniors where they would have to pay thousands of dollars more for prescription drugs. It would eliminate expanded Medicaid. Oh my goodness, hundreds of thousands of Kentuckians just completely without coverage that has saved lives during this pandemic. And you see other states, some people might call them red states, that when it goes on the ballot, overwhelmingly approve of expanded Medicaid. So it would undo a system that I believe is supported by the vast majority of Kentuckians, even if you have to get into some of the specifics to see that. Do I worry about what the Supreme Court may decide? I believe that if they look at it from a legal perspective, that the underlying decisions have multiple problems, including they decided more than was actually in front of the court, and that should require the Supreme Court to ultimately, vacate that problematic ruling, and in the very least send it back to the district court. And I hope that they will look at it as legal scholars and not as conservative or liberal jurists. Anybody else?
Just to be clear, if the Affordable Care Act is dismantled, what happens to everything that you guys have going on here in Kentucky?
Well, if the Affordable Care Act is overturned, we and every other state will lose expanded Medicaid, and so those will be hundreds of thousands of Kentuckians that suddenly have no health care coverage at all. I do not believe it will directly dismantle the exchanges, and so most of what is on Connect will continue, but we will have to do a lot of things here in this state. We'll have to pass state laws, which I've been pushing, banning insurance companies from kicking people off of coverage for a pre-existing condition. We'll have to outlaw discrimination in health care coverage, which is amazing that we would actually have to do that and that it's not upheld. We'd have to take a lot of other steps on coverage and affordability that are going to be incredibly hard without the federal support inside the Affordable Care Act. Now that the individual mandate, which was the most objected to part of it by some Americans, has been removed, what's really left is things that just about everybody agrees on. And so it's certainly my hope that they will uphold it. While what we're talking about today will remain primarily in place, it'll severely harm our people in terms of health care.
What's your administration's role in the litigation? This is David Cameron joining in with all the attorney generals who are challenging the ACA.
So in the litigation on the Affordable Care Act, I filed that as Attorney General, and we transferred the party that's at issue to the governor representing Kentucky. We saw that happen in the last administration where I would file certain things. I'm not sure, though, that Attorney General Cameron has joined in one way or another. I'd have to look at that. But it was important for me to stand up for Kentuckians. When I was Attorney General, I got involved in very few of these national level lawsuits where you see attorneys general from both sides, but that's one that's so important for our people. So the two things that hold us back, the two primary challenges that we've got to overcome in Kentucky are the health and the education of our people. And let's not set ourselves back. All right. Thank you all very much. A bright day for the people of Kentucky.